I'm Zach Martin with my guest, Dr. Dave. Can't wait to get into it this afternoon. We're going to discuss CBD products from VitaFusion. We're going to talk about Qsymia, a great weight loss medication. It's the latest and I guess the most effective that's out there right now. And we'll also get to COVID-19. Remember to order your VitaFusion CBD gummies. You can go to VitaFusionCBDHemp.com. We'll be back with Dr. Dave after this on NEWHD TV.
Why is VitaFusion America's #1 gummy vitamin brand? Because it fuses massive natural fruit flavors with a bajillion essential vitamins in a tasty gummy. It's a better way to vitamin. A fusion of nutritious and delicious. VitaFusion, vitamin better.
What is the guiding principle as far as deciding how much of this product you would need to take on a regular basis?
I base it on common sense, Zach. For me, it's more we start low and then build up. Where we could take 10 milligrams, it won't be harmful. You won't overdose on 10 milligrams. So you could start with the 10 or the 5. If you feel that the 10 milligrams is just too strong, you could take half of a gummy and then go to the 5 milligram at the next time you purchase. I tend to start at 10 milligrams as the standard dose unless someone's overly sensitive to it, in which case you can lower it to 5 or even half of 5. Just it depends on your sensitivity in terms of, does it make you sleepy? Does it make you tired? Do you feel any other kind of symptoms after taking it? None of these symptoms are dangerous or long-term or debilitating, most of my patients are very comfortable taking it daily without any issues.
Why is VitaFusion America's #1 gummy vitamin brand? Because it fuses massive natural fruit flavors with a bajillion essential vitamins in a tasty gummy. It's a better way to vitamin. A fusion of nutritious and delicious. VitaFusion, vitamin better.
Let's talk about some of the myths about weight loss and some of the facts you find interesting and how Qsymia can help you fight the battle of the bulge.
Well, Kassemia is a well-studied medicine at this point, and FDA approved. It is a controlled substance because of other factors that they don't want. The government doesn't want people kind of taking it without supervision, and should be, of course, taken with the care of a supervised doctor. Thankfully, at New York Medicine Doctors, which is my practice in New York, we have primary care specialist who understands Qsymia and could basically evaluate patients before they start. But the really cool thing about Qsymia is that it is proven to have patients lose weight. They essentially, studies have shown that with diet and exercise alone, so we recommend diet and exercise to all our patients, no matter whether they're on Qsymia or not. If you just do diet and exercise, you lose about 7 pounds after about 28 weeks. And then if you go out to 56 weeks, which is essentially a year, weight loss is still about 6 pounds, which actually means that you're relapsing and you're kind of picking up weight again. Whereas with Qsymia, there's 2 strengths. There's a 7.5 milligram strength and there's a 15 milligram strength. But with Qsymia, the weight loss is more, studies have shown that weight loss is on average 22 pounds per patient after 28 weeks with the lower dose and 29 pounds with the higher dose. So that's a good sign that it's dose dependent, because obviously the higher dose should suppress hunger better than the lower dose. And so then you go out to 56 weeks and the weight loss not only is maintained, but it's enhanced a little bit. So you go from 22 pounds in the lower dose to 24 pounds off. And in the lower dose, you get from 29 pounds to 32 pounds. So it's better maintained than just diet and exercise alone. And it also kind of keeps the effect and enhances the effect over time as well. And then the cool part is also that you tend to lose about 4 to 5 inches in your waist, depending on the dosage at 56 weeks. So whereas if you don't take the medicine, on average, it was 1.7 inches off the waist after just diet and exercise alone. So there's clear evidence that it works, and that's why the FDA approved of the medicine. It also is of note does not have many side effects actually. So the side effects are very mild, and there's not a lot of them. If you read the package insert, it'll kind of list off a whole bunch of them. But the real important thing is that they're reversible after you stop taking it. So if you do experience side effects, you just stop taking the medicine. Right. Or just say quarantining at home, and you see food, you tend to eat it. That's called the seafood diet, and it really kind of controls that. So you get less of the seafood diet. So when you see food, you don't have that same urge to want to eat it. So it takes down the kind of cravings. It takes down your desire to eat food. And so even if you see food or the food looks delicious, you don't really have to kind of dig in and eat a whole lot. I think that's really kind of its main effect. Obviously, with diet and exercise, that helps. So, you're eating the right kind of food, and then you're burning off the food that you are eating. Right. That helps a lot. But, even with good diet and exercise, you get these cravings in the middle of the night sometimes, and you have pizza at 1 a.m. sometimes. That's really bad for you, but your body just craves it at that time. And so if we could control those cravings and limit them, we could really kind of impact how much people gain and lose weight.
Do you know the background of how they discovered Qsymia and the effects? Was it? It was part of an older medicine that was just by itself. So this is a combination medicine. So they basically, the whole point of the medicine was also just the receptors in your brain. You have receptors in your brain that are controlling hunger. And so, when they're looking at various medicine, they look at, okay, what receptors do they block? What receptors do they stimulate? And then, you could tailor a medicine towards certain, receptor groups. And then when you get the right receptor, that medicine is going to work better than others. Why do most diets fail?
The main thing to worry about, just as far as just serious side effects are concerned, is just birth defects in pregnancy. So obviously, anyone who's pregnant or may want to get pregnant should not be on the medicine. So that's another thing just that I'd like to kind of share. I was saying essentially side effects were reversible, but obviously during pregnancy, if you get birth defects from it, those are not reversible. So pregnant ladies or women should be very careful taking the medicine. If not, just wait till after they're done with their child birth to initiate.
Follow-up question with that. What about men who are married to somebody or has a relationship and they want to have kids? Is it something that a man should stop taking?
It doesn't. No, it doesn't really affect sperm. It doesn't really affect the sperm. It just affects kids as they, fetuses as they grow. A fetus can get side effects such as, again, cleft lip, cleft palate. These are things that has been shown to happen with the medicine.
All right, and if somebody wants to get in touch with you to talk more about Qsymia and sexy gummies, or even VitaFusion CBD hemp products, how do they do that? I think
the best way is just to call the office, which is 212-991-9991. So that's very simple. Or visit us at nymdcenter.com. So it's just nymdcenter.com. So it's very easy to kind of contact us either way.
Right. Or NY Urology.
NY Urology is my urology website. Right. NY Urology is more the urology website. This is more for the primary care doctor in the practice, because I feel that, obviously you got to have a full checkup, not just the urologic health checkup. So that would be Dr. Tun in my office. And he does a ton of this. And he's also, just a great doctor overall.
Actually, he's my daughter's physician. He gave her the test for COVID-19 at the very beginning
Oh,
of
that's
the
great.
crisis. So we went over to the office.
Yeah,
and
we actually do right
yeah,
now rapid COVID testing in the office. So
yeah.
if you want to find out within 15 minutes whether you have COVID or not, we can tell you. So,
Well,
and it's not as bad of a COVID test as the ones prior where you had to stick it all the way up
it's
till
disgusting. Yeah.
till you get to the eyes. So,
Well,
now we have to stick it up, but not all the way as high as we used to.
yeah. Let
So
me tell you about that. I actually read a story. It's probably fake news that somebody had when they got the test with the swab that goes up the nostril into the back of the throat, I guess, that it penetrated, I guess that barrier and brain tissue came out. It's ridiculous.
oh
I don't know
wow.
if that's possible. I didn't really get into
Yeah,
the story.
they must have not done it right. That's never
Yeah.
happened in my practice
Yeah.
yet. But
Must use a crochet
definitely,
needle to get up there, right?
well,
Let's,
I don't know. I mean,
yeah.
and I think yeah. I mean, you have to be careful doing it. Obviously,
Well, here's the
if you meet resistance, you stop.
here's
You
the
don't want to push too hard
right.
once you get
But
there.
here's the problem. You have people that are not trained doctors or even nurses, they're technicians that have been administering these tests that you drive into, whether they're tents, it could be a National Guardsman, who knows? I mean, I just think we all have to be careful. Now, moving over to COVID-19, the president and the first lady were recently diagnosed as positive COVID-19. And from reports I see, he's got some mild symptoms. And there's a lot of criticism that he's
Right.
taking. I've been following a lot of the chatter between doctors on social media. There's various opinions about COVID-19. There's various opinions about the mask, which we'll get to because there's something about a mask that we all have to keep in mind. And regarding COVID-19 itself, I think that most of us at this point have gone to the various sites, whether it's the CBD, the NIH, or even to the World Health Organization. And based on what I've seen, what I've read, this COVID-19 is an RNA type of virus. So if you don't mind, give us a bit of an education because you're a qualified physician. You're a doctor. These are things that you know. I have a doctorate as well, but it's got nothing to do with medicine. So I'm not qualified to give any sort of scientific analysis. Explain to us exactly what COVID-19 is and this RNA strain of virus.
So COVID is a coronavirus, which has been around for many years. And the coronavirus is generally a virus that gets into your cells and it cannot grow on its own. So it needs a host to essentially replicate itself. So what RNA is a kind of a transmitter in the cell. People know what DNA is, right? So the DNA is your actual genome. It's what makes us who we are. The DNA is our genome. Now, what RNA does is that it actually gets into the cell and allows so the way the cell works is that the DNA gets transcribed into RNA. Then the RNA essentially makes proteins. It's a kind of a blueprint for how to make a protein. And the protein is the actual molecule inside the cell that does stuff, right? So if it makes proteins, those proteins then enable the cell to do its function. So the RNA, once it gets inside the cell, essentially becomes, the body doesn't know that's foreign RNA. It just knows that there's RNA in the cell. And the RNA looks like our RNA, so it's human RNA that actually has a function. And the function is to produce these proteins that are replicator proteins. So basically, it replicates the virus. So it takes over the cell and it makes it a virus cell, basically. So now our cells in our throats and on our noses are now making this RNA virus in large quantities. And why? Because it makes the protein that tells the cells inside to continue making more and more and more of the virus. So it just basically, when it takes over control of the entire cell, the cell only produces this virus, and that's why there's so much of this virus in someone who's infected, because it basically, that's all it does in your body is to keep making more and more and more virus. Once you make more and more virus, the problem is the cell at some point dies, because you're not doing anything else in there, right? The entire mechanism of the cell has now been taken over to produce a virus. So it's basically like a computer virus. Once a computer virus gets into your computer and just does read and write for itself, you can't do other functions in the computer. And basically the computer is called bricked, which basically means it's dead. And so the same thing happens within a cell. Once a cell dies, though, it's like a computer. You recycle all the parts, right? So it lyses, it means it explodes. And now all these viral particles now are all over the place. And those virus particles now are active, and they're infecting other virus particles. Now, at some point, your body picks up on the fact that, what the hell, we have all these viral particles here. And obviously, it picks up on the fact that these viruses have to be removed. And so, for example, if your body has a big response to these viruses, it'll attack the virus particles and create huge amount of inflammation. Or the opposite could happen, where your body does not realize that there are all these viral particles, and now these viruses are basically contaminating all the cells in your body, including your lung and elsewhere. So either if your body has a high response to it, that's not that good. And if your body has a very weak response to it, it's not that good. So if you're immunocompromised, for example, your body doesn't make a good response. And so it basically allows that virus to kind of spread everywhere. And if your immune system is overly kind of sensitive, it could also cause a lot of inflammation and make getting rid of the virus very difficult. So those are the kind of two key groups. Now, the good news is that it only happens in about 1% of the population, right? So 99% of the population know how to handle these viruses, which is great, And unfortunately, the issue with COVID that really is killing us, really, it seems to me like it's similar to any other kind of flu virus, right? The big issue with it is that it seems like it's a combination of 4 or 5 viruses in one. It's like a Frankenstein virus. And because it's such a Frankenstein virus, our body has never really seen it before. So if we get this virus as kids, like, for example, our kids are getting the virus right now, and the kids getting the virus are not very sick. Your body could actually easily handle this when you're younger. The problem is, as you start getting older and your body's never seen this before, that's when we start having problems, because now we have a Frankenstein virus that literally could either take over and create more inflammation than is needed, or take over and basically trick the body into thinking that it's not there. So if we had these antibodies already because we were exposed as kids, moving forward, we wouldn't have had these big responses like we have right now. The real issue is that, this is a new virus, and being a new virus, thankfully, this virus is very mild. It's, and people are going to attack me because I say it's a mild virus. But in reality, if 99% of the people who have it survive, that's a very, very mild virus. If it's a brand new virus out of nothing, and then it comes along and kills only 1%, and, obviously, I don't want any death at all. But I'm just talking in terms of just looking at historical viruses, like, the flu of 1918, for example, was much worse in scale and in just effect. The only real issue with COVID is that it's very contagious. So a lot of people can get it, without actually knowing it. And then once you get the virus, essentially, most people recover, and it's like a sore throat or a flu. There are just a small percentage of us, close to 1%, where the body simply overreacts or underreacts, in which case you now have worsening symptoms and issues. So
well,
I
what
think
about What about the long-term effects? I've heard people losing their hair. I've heard of, various other non-flu-like types of symptoms that break out that are causing trouble. And I really do believe that because they don't know what to expect, that's probably why we see a more aggressive stance in trying to prevent it with, using masks and
Well,
gloves and all of
well,
those things.
well, Zach, I have, I have some issues with kind of making claims like that, because if a large, like say millions of people have a virus and then they develop other things, people tend to associate the virus with having other problems, right?
Right.
And it may not even be the virus that's at fault here. And that's really where my problem is that sometimes people think that, okay, well, I just had the virus 2 weeks ago and now I'm feeling like I have lupus, for example. I'm not saying they're associated. I'm just giving just an example. That doesn't mean that the virus caused the lupus, or vice versa.
Well, it also could be the side effects from the medications you use to treat the disease as well.
Well, it could be that as well. I mean, some of the side effects could be from that, but really the main reason that I say this is people tend to associate viruses that they hear in the news as things that create major problems. And again, I'll give you an example in terms of influenza. When you pick up influenza, it could create lasting problems for you as well. Many of them are kind of sinus related, for example. You could get sinusitis, you could have ear pain, you could have ringing in the ears, all kinds of other things that, the virus could cause. And again, what we talked about, the virus in some people can spread a little bit out of control and go to different places, for example.
Right. Well,
and
what we're talking
different cells in various tissues. So,
Yeah.
I mean, it's not inconceivable that a virus, any virus, particularly the flu, or COVID or any virus, could actually go to, in very limited population base, go to other places. The problem I feel in this particular virus is that there are a lot of reports out there that tend to try to scare the population and to make it, quote unquote, a unique virus, which in reality, this is not a unique virus. I mean, it's a Frankenvirus. It is unique in that it's a new form of the coronavirus that we've never been exposed to before, but it's still a coronavirus. And, every virus, like for example, N1H1, which is the bird flu or the swine flu or whatever you want to call that, when it first came out was pretty deadly. And actually, studies have shown in the 4 to 5 years following the outbreak, almost the entire world has been exposed to the virus. And so that's what I wanted to say, is that in reality, we're all going to be exposed to COVID at some point. And the good news, if there is good news, is that when the kids get the COVID virus, that their response is very, very mild. And in which case, as they get older and they keep getting exposed to COVID or its various strains of COVID, they're going to feel better and better in terms of just it'll become more of a sore throat, and it won't really create that dramatic effect that we're all worried about, which is that the rare case that someone will die from getting the virus. Most people, as I believe that Trump and Melania is probably going to end up having a very mild case, because he was not really feeling symptoms of the virus and actually tested negative in the morning. And then because other people around him tested positive, he got checked in the evening, which is not his usual routine. And it turned out he was positive. So in my mind, it means that he probably was not symptomatic. He also had an appearance late last night, on the day he tweeted out that he had the virus. And on that appearance, he did not appear to be sick in any way. So this was a television appearance on one of the Fox News hosts. So I think that that's a great sign that he's probably going to recover pretty quickly from this. Probably within 2 weeks, he should be all ready to go for the next debate. So it's actually a fortuitous timing. He can't do as many campaign events, but on the other hand, I think once this is clear, once he kind of passes over this this infection, I think his chances of getting reinfected are extraordinarily small. You would probably need to get a completely new strain of virus to actually, of the coronavirus to kind of get reinfected at that point.
Well, here's one thing about the antibodies that I've read as well, and maybe you can shed some light on this. They don't stay in your system very long. So
that's a little bit of a fallacy, right? So, and a lot of people, they produce antibodies because they have a great response to it, and those are the super producing people. But the fallacy is that you need billions of antibodies all over your body, and in reality, you don't need that because you're exposed to viruses every single day of your life. And so, if you had huge amounts of antibodies for different viruses there, you wouldn't be able to really form new responses to new antibody,
right.
You have a limited set of antibodies, right? So, but it does keep some of the antibodies around. That's the cool thing. You don't need a lot. All you need is that early warning system. Like, I'll give you an example, like our smoke detectors right now. The smoke detector does not put out a fire. It just detects the smoke. If you don't have the smoke detector, by the time you notice the fire in your apartment, it will burn the entire apartment down. With a smoke detector and a nice alarm, it'll alarm you to get up and put out the fire before it causes much damage, which is exactly what it does. So you could still get a little burn of your oven, for example, but the entire house will be okay, which is what we care about. We care about, hey, I could still live in the house, but the oven needs to be replaced, right? So
right.
You get a sore throat the next time. Is that a bad thing? I mean, yes. I mean, you would rather not have a sore throat, but it's not the end of the world, right?
Right.
You still exist. And yes, I mean, like, remember the good old days when we just had the flu, right? We had symptoms for like a week or two. We still went to work. We still socialized with people. We just had to be careful how we touch things and make sure that we don't shake people's hand when we're sick. I mean, these are kind of standard precautions. But I think there's some kind of good news out of this, in that we got to be very careful how we wash our hands. So if people are more anal about washing hands, that's very important. I think it's also good news in terms of just shaking. I really don't shake hands anymore. I just fist pump because, it's not just coronavirus. People are scared about the virus du jour, which is, the coronavirus now. But I mean, we have viruses every single year, and that's really, we care about stopping virus spread is, all viruses, not just coronavirus.
I think I can really, I guess, get to the crux of the issue about this antibody thing. Much like HIV, once you are on certain medicines, after a while, you become undetectable. So what we're talking about is you have the antibodies in your system, but you become undetectable for COVID-19. Would that be the proper way of looking at it?
Well, it's not undetectable. I mean, it's just you probably will still be able to detect it, but it's very small quantities. I mean, sometimes you could still detect small quantities. I'm sure you could even detect HIV in small numbers, whatever the small numbers are in the bloodstream. It's more, when you say undetectable, I mean, how closely do we want to look at it? And does it even matter to look at it that way? Like, in other words, yes, I mean, all antibodies from, say, your flu virus tend to go down after you get the flu. So initially it's very high up. Are you with me still? You kind
No,
of, I lost.
sorry, it pixelated. So initially it's very high up, the viral load, and then it drops.
Yeah. So when you first get the virus, obviously your body is smart. It knows that the greatest risk is right around the time you get the virus, and then it keeps the antibodies high until you're fully recovered. Usually is about 3 months, 3 to 6 months. And then once the 3 to 6 month period is over, it tends to lower and lower it down unless you get reinfected again. For example, if you get reinfected again, it may spike up a little bit. But the really cool thing about your body is that it understands that when you're infected, you need more, and when you're not infected, you need less. And that's what you have the immune system for. So your immune system is important in maintaining your immune system and in maintaining how you care for your body. So you still want to have like good diet, good exercise. I mean, if you're healthy, your immune system is healthy and you tend to recover better, which is what we're seeing in COVID. If you look at COVID deaths, the majority or even 80% of COVID deaths are usually in the last year of someone's life. And that usually tells us that, we're, at that point immunocompromised, have other medical conditions. And so it's rare that someone without really any pre-existing condition dies of COVID. I mean, that's usually much less than 1%.
When we think about using the masks, and you made this point on social media, and I think it's spot on, where people will say, well, doctors during surgery will wear their mask the entire time. And you were blunt about it. Yeah, sure. They're not futzing with their mask. They're not laying it on a contaminated surface. They've got their hands washed. So whether we wear a mask or
but it's not only that. You see, what people don't understand is that when you're in surgery and you're wearing a mask, it's to prevent viruses from dropping into a patient simply, and not just viruses, but bacteria or sputum or anything from dropping into the patient, because the patient is literally within a foot of you. So any spittle that comes out of your mouth has bacteria in it. And that bacteria, once it drops in, whether it's contagious or not, could still grow in a wound while you're operating. So the purpose of a mask is completely different. It's to stop any bacteria from your mouth to actually getting into the patient. And that's the same reason we wear a hair covering as well. So we put a hair covering over our head also to protect our hair from not falling into the patient, because our hair has a lot of bacteria on it as well. I mean, now bacteria, it's okay to be on your hair, but then if you take the bacteria from your hair and you put it inside a wound, that creates an infection. So that's why we wear a hair covering. We usually wear like glasses, and then we usually wear a mask. And then also remember, the other important thing is that the mask, you still breathe air in and out, right? And we're talking about the virus. These particles are so small that they get around the mask and they can infect anyone around you. So just wearing a mask by itself is mainly protective of other people if you're coughing. So whatever you cough, little droplets come out and can infect someone 6 feet away, which is why they say you have to maintain 6 feet of social distance. The problem really is that if you just have a mask and you're sitting next to someone who also has a mask, you share each other's viruses as well, because if you're infected and you're breathing out virus, the virus is not stopped by the mask. And again, the real issue is that most people don't understand that. They think that once you have a mask, you're protecting everyone around you, which in reality is not true.